Hello everyone. I'd like to introduce Jessica Villeneuve. Jessica has been a registered massage therapist, or RMT, for over 10 years, having completed her post-degree program in massage therapy and successfully completing board certification exams with the College of Massage Therapists of Ontario before moving to Alberta to begin her practice. Jessica was a member of the Board of Directors of the Massage Therapist Association of Alberta for 3 years, holding the position Vice Chair and spearheading the MTAA School Approval Program to raise the standards of education for massage therapists in our province. She has also represented the MTAA as the Vice Chair of the Transitional Council for the Future College of Massage Therapists of Alberta, and currently sits on the working group for the regulation of massage therapy in Alberta. Jessica is passionate about the regulation of the profession in this province to ensure safe and effective care for Albertans. Jessica has been both an instructor and program coordinator for massage therapy schools in Alberta and is the creator of her own continuing education courses for healthcare providers. She has presented to a variety of patient populations, healthcare providers, and government officials. Jessica founded her company, Same Stars Wellness, in 2013 to provide ethical treatment to both pediatric and adult patients with complex conditions such as neuropathy disorders, cerebral palsy, mixed abilities, palliative care, oncology, migraine disease, and chronic pain. Jessica is a patient advocate, a chronic pain sufferer herself, and believes that care comes not only in the form of treatment, but from listening, validating, and supporting.
So let's get started. Can everyone see my slideshow? You're all good?
Mm-hmm.
Okay, perfect. So the topic lineup to today, I know that patients with neuropathy do not need to be told what neuropathy is. So we're going to skim past all of that. Everybody knows what your symptoms are. You know how horrible they are. It's not my job to tell you about that. It's my job to tell you about the treatments that massage therapy can provide you. So we're going to look at the basics. So what massage therapists do, what to look for in a massage therapist when you are choosing one, why massage therapy does actually work sometimes for neuropathy, what your massage therapy appointment should look like, types of techniques your massage therapist may use, myths and misconceptions around massage therapy, types of neuropathy and treatment, injury and treatment, oncology, chemo and neuropathy, diabetes and neuropathy, and then we're going to get into the nitty-gritty heavy stuff of the anxiety, the depression, the fear around having a neuropathic condition and how we as your massage therapist can help. And then we will leave some time for some questions and answers at the end. So as the ladies mentioned, that is my experience was I was actually diagnosed with neuropathy, a nerve condition 4 years ago, but my symptoms began 20 years ago. So I took a pretty hard fall. I was a national level gymnast, flat on my head. And at the time, they had actually sent me a couple of weeks before for imaging for my lumbar spine, which came back that I had fractures in L4, L5. But between the period of myself having the imaging done and the imaging results coming back, I fell off the high bars right onto my head. And I did let everyone know that I was in a considerable amount of pain. However, the imaging came back that I had fractures. They pulled me out of everything as a 14-year-old. So nobody really took an actual look at my neck or my shoulder. And being someone who has suffered from chronic migraine disease since I was little, I now know the patients that it's not that we downplay our symptoms, but the ones that don't sit in the doctor's office and cry, mainly because we're tired of sitting in the doctor's office and crying, you don't get heard. So unless you're sitting there in urgent care saying your pain is a 13 out of 10, sometimes the care level is 0. So it took me a long time to actually get some sort of treatment. It's a long road going forward, but I am now lucky enough to have a variety of healthcare providers that all of a sudden within the last 6 months all seem to really care, which is, it's kind of overwhelming, but it is That really, really helps on the road to either recovery or management. Now, as a kid who was not heard, and as an adult who was not heard, that's what really pushed me to start my own company. Because I realized in Alberta versus where I was trained in BC and Ontario, massage therapy is more, well, it's viewed more as a treat or a spa treatment in some aspects, where in Ontario and BC, and I'll get into this a bit later, it is one of the number one push for treatments by doctors. So they send you to a massage therapist the same as they would send you to a physiotherapist. And here in Alberta, there was nowhere that was an inclusive massage therapy company. We treat a lot of CP patients, a lot of severe nerve condition patients. We treat oncology, palliative, and there wasn't a home for those patients. So I made one. The funny thing is we don't really actually have a home because we've been searching for our ideal location for 2 years. So we are mobile. So that means we come to your home and we bring that home for great treatment to you. So that's me. I am the owner of St. Stars Wellness. So let's get into it. What is massage therapy? So the definition from the College of Massage Therapists of Ontario, my home college, is massage therapy consists primarily of hands-on manipulation of the soft tissues of the body, specifically the muscles, connective tissues, tendons, ligaments, and joints, for the purpose of optimizing health. So it's not really a spa treatment in a regulated province. Massage therapy treatment has therapeutic effects on the body and optimizes health and well-being by acting on the muscular, nervous, circulatory system. Physical function can be developed, maintained, and improved, and physical dysfunction and pain and the effects of stress can be relieved or prevented through the use of massage therapy. The tricky part is the practice of massage therapy can differ greatly depending on the practitioner. There are spa-like massages, and then there's the ones that are more clinical based, like we do with our practice. Finding the proper therapist in clinic is essential to gain relief from your neuropathic symptoms. So as a patient, you may have to do a little bit of digging. I'm going to offer you some places to find a really great massage therapist that will know how to treat your condition, but I do not recommend you type in massage on Google and just go forth and grab the first massage therapist. You really want to find somebody that focuses on your condition, that is really well versed in your condition, because they are out there, but it would be a waste of your time if you didn't find the best practitioner for you. Let's go back for 1 second though. One interesting note I did want to touch on here is that I can confirm, as a neuropathy patient myself now, is that the base schooling for massage therapists, so it's usually about a 2-year program in Alberta, but even in other provinces where their programs are a bit longer, they do not teach enough about neuropathy. They do not explain it. And I'm fairly certain that the description of neuropathy, even for courses such as physiotherapy, doctors in general, we can mostly probably agree, chiropractors, they don't really send it home how horrible the pain is. And in some cases, the best way to find treatment is to find somebody who has a lived experience in your treatment. I know that for myself as a migraine sufferer, it does make a difference when my practitioners have experienced migraine, because they truly know how horrible it is. So they may say things such as tingling, sharp shooting pain when they're teaching nerve pain, but nobody is sticking you with, I don't know, some sort of zappy thing to like light your whole nervous system on fire. Nobody is making you so exhausted before you finish that term to realize how bad that pain is. So I can 100% confirm that schools need to do a little bit better job when they are describing pain to the practitioners, no matter what type of practitioner it is, because it is incredibly life altering. And sometimes when that's not explained to the practitioner, they may brush you off. They may kind of roll their eyes, maybe not in front of you, but I think the advocating that the Calorie Neuropathy Association does, and all of the associations around Canada. They do an amazing job to try and educate the public. And one of the jobs I take on as the chair of our school approval committee is to actually educate the schools that they need to do a better job of educating the practitioners in all sorts of aspects of pathologies, not just neuropathy. But I think if I could find one way to go ahead and take every single kid that's going through for an MD, and maybe give them a migraine, maybe give them some C5 nerve root irritation so that they would just be a little bit more empathetic when you go and sit in their office, wouldn't that be wonderful? Not to wish pain on anyone. But yeah. So that is my approach to training though. So I'm very much the type of person that will sit through courses that I teach and explain and explain and explain every different part of how a condition does affect a person's life. So the more that you can describe to your practitioner about that, and either look them straight in the eyes when you do so, or take cue cards I tell my patients to, so that you don't miss anything, and explain, like, I can't get out of the bed in the morning 5 out of 7 days of the week, and I'm not kidding. Or I can't get to 2 p.m. without breaking down in tears. The greater job we do as patients, even though it shouldn't be our job, in describing the pain, the more engaged you're going to see your practitioners become, hopefully. So why does massage therapy work for neuropathy though? So massage therapy is usually between 60 and 90 minutes for your treatments. You can have shorter treatments, but when we're looking at the average ranges of 60 to 90 minutes, those are times that are much greater than what you would spend at a chiropractor's, at your doctor's office, or even with a physical therapist after your first initial appointment. So massage therapy gives you the ability to have more hands-on time. Your therapist is actually going to be providing you treatment for a longer period of time. That means we get to take time to slowly approach your concern, especially when we're working on a nerve issue. We don't want to go in and treat really aggressively right off the bat. That's actually just going to make the whole nervous system very angry. So you get that dedicated time to yourself. And if there's more than one concern, usually there's time for that to be treated. So say we have something going on in our brachial plexus is causing nerve pain down into the arm. We can treat that in 60 minutes, but we can also treat then the neck that has become sore because you've been compensating. So we're in a really unique position as healthcare providers to provide you with a longer treatment that can be more effective. So in short, massage therapy can decrease sympathetic nervous system activity. So it's like the fight and flight, the constant feeling of being go, go, go. That's where you're going to see a lot of pain signals, widespread pain. We can help decrease that by actually bringing the body into a state of relaxation, decrease swelling and lymphatic congestion. If we have a lot of lymphedema going on, sometimes that can affect the nerves. So especially when we're looking at oncology treatments, by moving that lymph fluid up and away from the area, you may see some decompression of those nerves. So that might alleviate some of the neuropathy you're having down into your arm per se. Decrease muscle tightness. So if we're looking at like cervical spine root, if it's a nerve root impingement, or perhaps even a bulging disc that's causing nerve root irritation, by releasing some of the muscles around the spine, sometimes that can allow the spine a little bit more space, and that's going to take some of the pain off of that, or some of that pressure off of the nerve, decreasing the pain for you. We're really good at that. That's something we're very underutilized for, because the first thing as a patient you'll get told to do is go to physio. Most often and not, if it is a hands-on portion of physio, we know how to do that. We're actually the ones that are trained in the hands-on portion more. We can also provide the home care, but a massage therapist can focus on those muscles and they can alleviate some of that pain. A big thing that comes with neuropathy is the lack of sleep. Either you're waking yourself up at night, well, your body's waking you up at night because you're in pain if you move a certain way, or you're in so much pain after the day that you lay down in bed and everything hurts so much, you're not getting a good night's rest. That is one of the reasons why sometimes they dose up with gabapentin or pregabalin so heavily at night, because they just need you to get a rest. So that is something we're really, really great at. We can help slow down that nervous system, help alleviate some of the swelling, the pain, put you into that state of feeling comfortable. And more often than not, if you have nothing else planned for the day, we do promote going and having a nap or going right to bed after your treatment so that you can really harness that benefit. Decreasing overall pain. A lot of time, if we're having neuropathy of one side of the body or it's widespread, say in like the whole lower area, you are going to be compensating in other portions of the body. Or if it's a cervical spine condition, a lot of times it causes headaches. We're seeing nerve roots that are actually becoming very, very aligned with cervicogenic headaches. So when we're looking at one portion and it's just the nerve pain, we're actually able to affect the whole body and its pain as well. If we have decreased mobility, of course, the other joints are going to get sore. So as your massage therapist, we can get you on the table or treat you wherever you please and work on those joints that haven't been getting the movement that they might have been needing. And that itself can decrease your pain quite a bit. One of my favorites, especially with working with chronic pain, is decreasing the symptoms of anxiety and depression. We'll go into this in depth later into this presentation, but we cannot, as massage therapists, actually treat anxiety or depression. It's out of our scope of practice because that is a mental health aspect. That's where a psychology, psychiatrist, but we can treat the physical symptoms. So we can help promote that sleep, which could help decrease your depression, anxiety. We can help the pain, which comes along with depression, which comes to not being able to get out of the bed. We can help you breathe better by working on muscles of the diaphragm and the ribs. All in all, it does help you relax and it does take away some of that depressive feeling. And it's pretty awesome when we get to see our patients and we're the happy appointment that they have that week. So when you find a compassionate care provider, it makes a difference, and that's what we're here to do. What to look for in a massage therapist. So you want to look for an education aspect, a compassion aspect, and dedication. The average course for massage therapists in Alberta is 2 years. So, as I touched on before, Alberta is not a massage therapy regulated province. So what that means is there's the Health Professions Act. So you have your College of Surgeons, Doctors, you have your College of Physiotherapists, you have your College of Chiropractics. In Ontario, BC, and a couple other provinces, massage therapists are regulated right alongside them. So we fall under the Health Professions Act, standards of practice, and we're actually regulated by an overseeing college. Here in Alberta, there are 4 different associations. So in a regulated environment, the college's job is to protect the public. And they do a fairly good job of it. I've been involved in the one in Ontario, and that is their heart and soul. They want to just make sure that the public is protected. Here in Alberta, those associations play dual roles. So it is a conflict of interest. That being said, we have been fighting for many years to get into the Health Professions Act. We will get there eventually. But from a patient standpoint, that makes finding a therapist harder for you because there is no set standard. The set standard is an hourly amount for training, 2,200 hours. There is no set standard for what needs to be taught. So it varies greatly throughout Alberta. You will see students who perhaps did 99% of their program online, which makes no sense because we are literally the most hands-on profession in the world. Mm-hmm. It's challenging. It's challenging as someone who came from a regulated province because I'm so used to rules and boxes and patient care. And I will continue to fight for this, but unfortunately, it just means that you have to do a little bit more work when you are looking for a therapist. So you'll want to ask about what does the practice or clinic look like? What kind of accessibility options does it have? Is there an elevator? Is there a ramp? Because I can tell you from searching for a clinic space, not all places are accessible. They should be, because technically everyone deserves the same amazing care, but you need to make sure that that is accessible before you show up. Another thing is, do the therapist have training in your specific condition? technically, many people will say they have specialization in something. Dig a little bit deeper, ask, how many patients have you seen with that condition? What types of treatments do you do for that condition? There's some red flags, there's some green lights there. So if they seem confident, they can describe to you some of the symptoms, some of the pathology that you have, then that would be a good choice to book in with them.
Can I ask a question?
Yep.
It's quite often if you're phoning a clinic, it's really the receptionist or the office manager that you're talking to. And they'll probably give a stat answer that, oh yes, our people know what they're doing. And, you know, so do you ask to specifically speak to the massage therapist?
You could ask that the massage therapist give you a call back, or ask to speak to the owner of the clinic, because yeah, it is unfortunate. A lot of people say like, oh yeah, no, I have lots of experience in that, or oh yes, they know how to do that.
Mm-hmm.
Sometimes they don't. And if it is the front desk person's job to sell appointments, then you're not getting a truthful answer.
Yeah.
So most definitely, I would ask to either speak to the owner of the clinic or the massage therapist himself.
Great.
And don't hesitate.
I'm sorry, I always forget this at the beginning of the announcements. If anybody has questions, please use the chat box and I'll relay your questions on to Jessica.
Thank you. Yeah, I honestly, as patients, do not hesitate to ask those questions. It's your care. You deserve the proper answers. You deserve to know whether or not that's going to be the best treatment you're going to receive. So always ask. It's the way that everything should be. It shouldn't be just you go and you get a massage because they say that they have a set amount of hours training. There is harm that can be caused, especially with nerve conditions. I've been one of those patients on the table where somebody worked way too aggressively, and it was not a good week after that. It actually kept me from seeing my own patients. So if you ask the questions and you get a lot of detail from them, you're probably better set up to actually have a good treatment. So emailing and calling for a consult is also something that I recommend doing if you're not getting those answers. Email, address it to the clinic owner, and then really ask every single question you want. Write them down before. So say, hey, I don't feel comfortable getting a treatment on the massage table if I'm coming into my wheelchair. Is your massage therapist experienced in treating in a wheelchair? Do they have patients that have been in wheelchairs, instead of do they know how to? Because the answer is always, unfortunately, going to be yes, but asking the specifics. One of the best patient advocations I ever experienced was, I have a gentleman who was in a care home, and his brother actually asked me many, many questions. It was about autism. And I said, yes, of course, like I have advanced training on that. I've seen many patients, or I have a lot of experience. And he's like, well, can you please give me specifics as to what kind of experience you have? How many patients have you treated? What were their symptoms, or what was their presentation? I was like, no, thank you very much for asking me those questions, because I felt confident answering them. And that way he felt confident having his brother treated by somebody who did know. But you don't see it very often. Usually it's the quick question of, do you treat like XXX? And that's not enough. We have to get into actually treating the symptoms. So hopefully that helps. Take your time. Always take your time. General rule of thumb, if you go to book in for a massage and they have availability that day, either they don't have a ton of experience, or maybe it was a fluke. That can happen. Sometimes that happens, last minute bookings. But if you're looking for experienced massage therapists with a good following, you probably are going to be waiting at least a week to get in for a treatment. And if it's weekends and evenings, a lot of them are usually booked up for quite a few weeks. So in Alberta, because we are so heavily saturated, because it is such an easy program, that's one way that you can usually tell. Another one that you might want to ask is, do they do any volunteering with the community? So I know our therapist and myself, I've worked at the Ronald McDonald House for years because we're passionate about pediatrics as well. So that's something I like to tell parents when they're booking in for kids. We've done the kidney march, we do the ride to conquer cancer. So if they're involved in the community, because then you know that they're fighting that fight with you. And they're probably somebody really great to book in with. So let's chat next about what a massage therapy appointment should look like. It's not show up, get on the table, here's your lotus spa looky thing with the pretty pillow and the towel folded like a swan. If you're going for a therapeutic treatment, there is an intake. So when your massage therapist brings you back into the treatment room, you should have filled out a health history form. So these are usually quite in depth. There's a lot of reasons why. So we want to know what your condition is, if there was an injury, how long it's been going on for, when your symptoms become aggravated, if your symptoms ever calm down, how does it affect your active daily living? Do you have any other conditions? Are you taking any medications? Please list all of them, even if you don't think they're important to us. What your pain level is like, if there is any radiating pain. So especially with neuropathy, like where's that pain going? And then describing the pain. So usually there's boxes that give you the little check marks for, is it sharp, tingly, shooting, achy, dull? Is there going to be a health history of any other conditions in your family? Have you had any imaging? Kind of things like that. Have you had a massage before? Is there anything else that you want your therapist to know? With my intakes, we always say, do you use any mobility devices? Do you use any other sorts of devices? What is the best way to communicate with the person? Because not everybody is going to walk up to a treatment room, and that should be given the option. So you feel comfortable actually explaining everything you want on that treatment form. It will also say your birthday. For the systems that we use in place, like our online booking system and our home care, we do need the birthday, or I have to make you up a birthday, and it's usually my birthday. So we do have quite a few patients that share the same birthday with me as per our online booking system. But please fill out your intake forms fully. This gives you, your therapist, the opportunity to review them and make a plan so that when you get there, they've either done some extra reading if they needed to, or they feel confident that they can ask you any other questions that might be needed for follow-up when you get in the room. So after we go over your health history, there may be some orthopedic assessments, as we call them. So that's the bending side to side, asking you to move your limbs, putting you in different positions, asking you if anything irritates the symptoms, makes them come back, makes them better. This gives us the ability to kind of pinpoint where we're going to be working on. Formulate a diagnosis if you don't have one already, or we always do want to check a secondary diagnosis. So we know you have something wrong with the brachial plexus. We still want to check it. This also gives us the opportunity to reassess at the end of treatment and to check to see if what we're doing is working. This gives us the timeline. We can adjust our treatment next time. We can adjust your treatment plan. So it's not quite just the get into the room, get on the table type of thing that you might be used to when it comes to massage therapy. These conversations are very similar to physiotherapy, but this allows us to give you the best treatment possible. So the treatment itself, safety, consent, pain scale, patient-led care. That is what you should be getting when you are getting massage therapy treatment. That consent portion is huge. Before you get on that table, before they even lay a hand on you doing an orthopedic assessment, they need to ask for your consent. It should also be in your online or on your forms. Do you consent to treatment? If there's any changes in the treatment than they've proposed, they should be asking you for consent again, so that you feel that you are empowered to stop the treatment at any time. Or if you want to make some recommendations, tweak that treatment plan, you have the ability to do so. So there's always the 2 sheets on the massage table. You usually get in between the 2 sheets. You can keep your clothes on if you like. I think this is a huge misconception about massage therapy. It's what you feel most comfortable with. Sometimes it's easier, say we're working on the neck, the back, if we do have the shirt off, so you're face down, only the portion of you that will be undraped is what we're treating. We're not going to just undrape for the sake of undraping. You want to feel safe and secure. Those linens are tucked in nicely so it doesn't feel like there's wind blowing anywhere. Your legs aren't being undraped if your legs aren't being touched. So always comfort and security. Are you going to be on a massage table? You don't have to be. You can have a massage in a chair. You can have a massage if we're coming to the home and you're most comfortable in bed, or you're having issues getting out of bed that day. If you'd like it in a mobility aid, we can work around those things. The fact that there's the table should not be a barrier to treatment for anyone. So it won't look like a spa treatment almost. That means you still get the care you deserve. Types of techniques that they will use. So you've got the long strokes, which we call effleurage. Those are just the kind of normal, gentle massage therapy strokes. Light stroking can be beneficial if we're looking at relaxing, not something I like to use too much with neuropathy, as it can excite the nervous system actually. If we go kind of in like little skin stroking, it can make the nerves a little bit cranky because it gives that red alert to everyone like, oh, time to wake up. There's kneading, so that's the circular kind of treatment. You've got deep tissue work. Not everyone needs deep tissue work. If that's what you prefer, that's what you feel brings relief, you can tell your therapist that. Just because you're presenting with nerve pain doesn't mean that you have to be treated like you're China. I think sometimes therapists forget that the patient knows best when it comes to their body. You'll also see some stretches that your therapist may put you into, some joint mobilization. So not like a chiropractor, but just a little bit of tractioning that can help some nerve impingement in the joints themselves. And a lot of relaxation techniques. So if you do want a scalp massage at the end to promote sleep, don't hesitate to ask for that. Some additional types of treatment that your therapist may use are hydrotherapy. So hydrotherapy is awesome for neuropathy, depending on the patient. So warm packs, cool packs, things like paraffin wax, they feel great, they feel nice, they can be beneficial. If you don't want hydrotherapy used, that's up to you as well. You can tell your therapist. But I know one thing when we're looking at different types of neuropathy, especially the feeling of cold, it can make it worse. So if you're cold on the table, ask your therapist if they have a heating pack. If the whole experience is more comfortable, we're going to get a better result in the area that you're suffering from the neuropathy. Cupping is something that you may have seen. It can be hit or miss with neuropathy. I don't recommend jumping right to it, or it shouldn't be used just for the sake of it. We don't want to be using it too close to the spine if we are having issues with bulging discs. It can bring a little bit too much blood flow to the area. If you stick a cup on something that's already tingling, it's going to tingle more because it's pulling on the skin. But if we're using it in the areas that have compensated and become really tight, it can work great. Hot stones. So if we're dealing again with slow circulation, pain, aching, they can be great. We just have to be very, very careful if there's any loss of sensation. That hot packs, hot stones, anything that's involving heat or cold is not going to injure you. So
can I ask about like myofascial release or active release?
Yeah, so myofascial release, we use that one a lot. We're actually working on, so there's skin, fascia, muscles. It's like the saran wrap that kind of goes around the muscles.
Yeah.
Not the prettiest way to describe it, but it is. Fascia can become stuck in a non-scientific work. So if we're looking at different areas that have become really restricted, your therapist most likely isn't going to be using an oil or a lotion. If there is a lotion, it doesn't have a ton of glide to it. And we're actually going to, you'll see like an assessment where we're going to go, oh, it moves this way a little bit better than it does this way. So it's a slow, sustained, medium pressure, and we're actually trying to get everything to peel apart. So it's like a stretch for your skin, but at a deeper level. This can create a little bit more space so that the muscles themselves can then move within the area. Some people love it, some people don't love it. It's a great technique to warm up the tissue with as well. And it is very effective if we can't get in and use any deep kneading or deep tissue, because we're still allowing for movement, and movement is usually good with neuropathy.
That's fascinating. I've done actually a myofascial release class at a yoga studio, right?
Mm-hmm.
And you could definitely tell the difference by the different activities that they gave. Say in my feet, right? They would roll out the feet, and you could physically see once you've done one foot and not the other, you could physically see the difference in how much looser, I guess you could say, the foot was, and able to move. Yeah, it was fascinating.
That mobility.
Mm-hmm.
Like once we get a little bit of an increase in the mobility, the pain does go down.
It does, yeah.
And it's something that we can always send patients home with too. Self-myofascial release is great. Sometimes cupping is used for fascia release. Sometimes it's used where it's static, like put on.
Mm-hmm.
But usually what we like to do is start off the treatment with it, assess where we're seeing kind of restrictions or lack of movement is a better term, and then go forth with it. Active release, though, it's one of my personal favorite treatments to use. It can be painful depending on it can be a little bit painful depending on how, I can't say like, oh, it's painful. Okay, it's painful depending on how aggressively we're doing it, but we're going to pin a muscle, and then we're going to get the patient to actually move the muscle. That's going to work almost in a nerve inhibitory mechanism. So we're kind of blocking the ability for the nerve to fire straight through the muscle while we're making you completely activate the muscle. So you will see that muscle go fairly lax. The interesting part is too, it's not just myself that is causing you pain, you're helping me.
Yeah.
So I prefer it as a treatment. Now we do try and stay away if there is a lot of active neuropathy in that muscle itself, because we don't want to aggravate anything. But if we're seeing the nerve pain, perhaps maybe more in the posterior shoulder, we're going to use that in the shoulder girdle to get that movement then. So if we release these muscles all in here, allow that shoulder to sit back, we're going to take some tractioning off the nerve.
Okay. We have a question from Stan, and I think it goes back to the hot and cold therapy. Can a hot tub be beneficial for neuropathy in the feet and legs?
It can be, depending if you have sensation in the feet and legs. So we don't want to ever use hot if we are lacking any sort of feeling, if we can't control the temperature. So if it is a very, very safe temperature and you feel confident going in, then you're good. One thing I do recommend is if we're going to be in a hot tub or a bath for a long period of time, when we get out, maybe elevating those feet up to bring some of the fluid back out of the legs usually helps lots. But yeah, especially if you're having tingling and that dull, achy pain, bringing heat to the area can be really beneficial.
Do you find people complain, like I know myself, my feet will get ice cold, and then if I try to warm them up, they will often swing very much the other way so that they end up burning. And I'm guessing because you've activated the nerves and they're just saying, but I find if I do it slowly, it works a lot better and a lot less painful.
Yes. So if we are in a lot of pain, we're feeling ice cold, and we go jump in a hot tub or a hot bath, it's going to burn and it's going to hurt. So better recommendation, put socks on and then place a hot pack over top. So give them that barrier instead of even just putting the hot pack right on top, and do the slow warm up and make sure that the rest of you is completely warm as well. Like you're staying as warm as possible, because the burning is never good. And then you have the throbbing, and then you're not pleasant either. It's not pleasant either way.
Yeah. Yeah. And, Pat says hot, cold. Yes, Linda, me too. I also have a friend who has like the diabetic ulcers starting, and I recommended to her that she keep her legs. She's already had both feet amputated actually, so it's her stumps that are getting these sores. That she keep them as warm as possible to help promote the healing, because when they get cold, you're not going to have the healing. You're not
getting any blood down to the area then. So we need blood flow to promote healing. We need to keep it nice and warm. When it comes to, so fibromyalgia, even though they haven't, have they actually determined it's a nerve? In my opinion, it's a nerve condition. It has to be. But automatic it will flare up as soon as we get a cold snap, because the whole nervous system of the body's angry. And when the nervous system gets angry, it is in control of a lot of things. So when it gets mad, a lot of things get mad. So always do I promote, like, any type of neuropathy, trying to keep yourself warm and comfortable.
Yeah.
Even when we talked about, like, if we're having acute nerve pain and we're having that burning, ice is not going to help that. It doesn't. And then you feel even worse when it doesn't help. So I don't recommend using cold on neuropathy very often at all, unless it's an acute injury and we're seeing, like, okay, maybe that's going to help some of the swelling pain, like the throbbing, but for nerve pain, no.
Okay. Oh, here's one from Bill. If your neuropathy is mainly in your feet, would the therapist mainly work on your feet, or would he or she massage the rest of the body?
That would be up to you. So what I do recommend is, if we're going to be treating the feet, we should always treat at least from the hips down, because we want to open up, get that lymphatic system moving. So we treat minimum quads, knees, calves, feet, focus on the feet, and then a nice flush to get everything moving back up. If we just treat hands or feet and we do a lot of work to them, we're bringing too much blood and lymph down to those areas. And then they're going to be very, very sore. So it would be a discussion you'd really want to have with the therapist. Like, can we focus on the feet, give it a good 25 minutes out of the treatment? At least I would really like that. But then please, yes, either do my legs or my back, etc. I don't remember the last time I did a quote full body massage. That's not my jam. I don't do relaxation. I don't have enough time because I treat a lot of pathologies and a lot of injuries. So for 16 minutes, if you're looking at that, you can't fit the whole body in and then actually focus on an area. So make sure that your main concern is heard. Make sure that you tell the therapist that this is what you want to focus on, and then make a game plan with them that you agree upon. Yeah, I would definitely treat more than just the feet for sure.
Right. Excellent.
Mm-hmm. Sorry, it's cold in my house today, so I have 2 space heaters because I can't get cold, so I get really thirsty.
Actually, you said an interesting thing about fibromyalgia, and because I do believe it's a neuropathy, and a cold snap. As soon as winter hits, they feel it a lot more, and and I know for me, as soon as October hit, I get cold, and then I feel like I don't warm up until May.
I can't get warm anymore.
Yeah, and is there an explanation behind that? Do you know?
I think it depends. Like, I think with fibro, like, we're gonna see the body like, your nerves are in charge of, like, temperature control, right? So as soon as it feels like you're getting a little bit of a cold tinge, your body's going to go into almost shutdown mode. It's going to take it. So if we have an overactive nervous system compared to a regular nervous system, and we get a tiny bit of cold and our nerve endings are a little bit more active, or parts of the nervous system are, it's going to send a pain signal back to the brain much faster. And what the body does as soon as it is cold, it takes its blood and it moves it inwards because it needs to protect your organs. Mm-hmm. So something that we could think about then is, if it is fibromyalgia neuropathy and we have those overactive areas, it's telling our brains way sooner to bring everything in, which is going to leave the limbs cold.
Oh, okay. Because I know, for example, I keep it warmer in the winter than it is in the summer. But if I'm outside and my feet get cold, then it's all bets are off for the rest of the day.
I bought those electric socks.
Yeah.
I can confirm that if you do not replace the electric socks and you're wearing them while snowboarding, because I still try and snowboard, I just cruise now. Yeah. And there's a little bit of a exposed wire. It does feel like nerve pain when it's actually electricity that's hitting your toe.
Ouch.
I thought, I was like, oh no, they're like, this is bad. Like, it's gotten way worse. Like, my foot it's not okay. I have to go to the hospital right now. No, it was the electrical cord. So I am a big fan of those though, like the actual heated clothing, but Make sure you can get one that you can adjust. And if you have any lack of sensation, probably not the greatest idea because they will misfire, but they do actually keep you warmer. We do suggest our patients get some.
Yeah, and my husband bought me a pair of heated gloves and they had a hot spot.
Ooh.
So you have to be careful of that. If you can, try them on in the store before you take them home.
Yeah.
Because you can definitely get a burn if
you can.
It's really shocks, yes.
I did not expect that. And trying to get a snowboard, it was actually while I was on the chairlift, so my foot was not where I was trying to get to it. And I was like, oh my goodness. But before that incident, it was actually quite pleasant. Okay. So something to look into, but yeah, safety first, always.
Yeah.
Okay. Let's talk about some myths though. So massage is not just a spa treatment. It can be very, very effective. It can be a little bit less stressful too as well than the average appointment. So instead of going to your neurologist, they're not always the most welcoming individuals. They have very busy days and they have very complex brains. Some of them are lovely. I actually did just meet one that was lovely. And it's not as clinical. It can be not as clinical as physio. So we're not going in and we're not getting any IMS needling done here in Alberta. It can be more comfortable. So it's a comfortable table or it's a comfortable position that you're going to be in, but we can still work on pathologies and severe pain. Another big myth is that massage needs to hurt for it to be effective. No. If that's what you find works for you, articulate that to your therapist. Let them know, can we work on that spot a little bit longer? That's where I'm actually feeling the pain. That muscle's been horrible. I've been crunching my shoulder or my calves hurt because I can't be walking as much because of my foot neuropathy. Let them know, ask them to go a little bit deeper. You can have a discussion about it, but it doesn't always have to hurt. We really, really should be avoiding going over an area that's actively irritated with nerve pain because it can leave you in a lot of pain for days to come.
Okay, we have another question. In your personal experience with a peripheral neuropathy patient, what has worked the best in you and your patient?
What types of treatments has worked the best?
I believe that's what the question is, yes.
Each patient's different. So the way I experience pain is going to be different than from how you experience pain. So it can be a little bit of trial and error. Like, depends. Usually starting off with a good assessment, talking and talking and talking, seeing what the goals are of the patient, going in a general treatment and then pinpointing the area around it. Or if there's nerve entrapment somewhere up higher, we want to be focusing on that as well. But it depends. I'm a big fan of giving home care as well. So physiotherapy, we can give the exact same home care, so exercises. However, I do my best as a practitioner to also take into consideration the realistic amount of exercises that a person can do. Because life shouldn't be about completely just doing your exercises and going from appointment to appointment. So assessing the fascia, seeing if there is movement restrictions, seeing where we can work on those first, working in, making sure there's not going to be any areas that are going to irritate the nerve, going in, working a little bit deeper. As I said, I like to do a lot of the ART because I find it more effective. It decreases the amount of digging we have to do, so it can decrease the inflammation. Trying to keep inflammation to a minimum is important. And then always asking the patient how they feel afterwards, giving them the realistic timeline of when we should see them next. But I like ART. That's personal though.
Thank you.
Did that answer the question?
I believe so.
Okay. If my questions don't answer what you were hoping to have addressed, please do let me know. The other myth, as I discussed a little bit earlier, is we don't need to know your health history. We do. The spas might not. They might not ask you for it. They technically should be asking you for it so that nobody hurts you. But we really, really do need to. There are a lot of contraindications and considerations that we take into consideration when we're making a treatment plan for you. depending on medications, depending on where we can feel, where we can't feel, depending on what does flare you up. So the more information we have, the better. I really like to have either the report or the actual imaging from MRIs. Well, some of us are trained to read those. You can read a report for sure. So always include the report. This will give your therapist an idea of exactly what is going on if it's something that is seen in imaging. So that will cut down on a lot of unnecessary things that are treated. Instead, we'll get right to the point. It'll be effective. The other part of the health history is it changes. If you're like me and you get a new medication every 3 months, just go into your appointment and let them know. It's not bothering anyone. I would much rather know what is going on 100% because we're invested in your care than you feel like you're being a burden. Another myth, you're not a burden. Don't let anybody ever tell you you're a burden. You are a human being.
Quick question. You said about bringing the report from your MRI.
Mm-hmm.
I don't think I've ever been given the report. It always goes to my GP. So do you have to go and ask for it and get a copy?
You can ask for it if they're going to charge you for it.
Mm-hmm.
Then don't. You could ask to take a screen. You could ask to take a picture of it on their computer. You could ask them specifically what the report says and just jot it down. They're very descriptive. So it'll say nerve root impingement C2, C3 if it's something like an injury or a bulging disc, right?
You mean from your GP though, right? That's where you're getting it? Yeah.
Yep.
Yeah.
If they have it, if it's something specific. So say it is like you have disc issues that are causing neuropathy in the lumbar spine. We would like to know where those are, if you can. If I email them, they will not tell me because I am a massage therapist. Right. They usually will tell the physios and that, but not here in Alberta. They won't tell me, but it's not completely necessary. If you have a handle on what your report may have said, absolutely great. But you're seasoned, you're good, you've got this down. If it's a new thing and it's a new experience that like you had an imaging and you might want to maybe make some notes on what it said. I really wish they would just print them out for everyone. I don't see why they wouldn't, but I know I've had some tiffs before.
Yeah, well, fair.
We like the information. We can get around it. It's actually far more important that we know what medications you are on. So if we could get that one down, at least that would be good. So the other myth, what was I going to explain to you? There was one other that I just thought was so interesting. No, people are not a burden. You're not a burden though. I feel as though that becomes over time with appointments and appointments and appointments. We tell ourselves that myth, like you are just becoming a hindrance to that person, your provider's day. You're not. They want to do the best job that they can. So you deserve great treatment. Okay, let's hop into specifics. So Linda was so nice to send me a list of what is most common in the group. If I do not touch on one and you want to know if massage therapy can help, please put it in the comments. I can happily answer. Injury. So, yep, definitely the most common that we're going to see neuropathy from. Usually we're looking at spine, whether it is cervical spine, so neck, thoracic, or lumbar. We do see brachial plexus with shoulder, or we do see neuropathy coming from issues with the nerve roots in the lumbar spine going down the legs. So they are common, however, they can be overlooked. So these are some of the ones that I find because they're not so special, the pain is overlooked by practitioners. A lot of my patients have either gone to Calio Clinic or to another spine specialist if they are an injury neuropathy. It's challenging because your description of pain is what we call subjective, but an MRI finding or range of motion finding is what is called objective. And in order for surgeries to usually be pushed through, Sometimes it is that objective that's looked at over the subjective. So when we talk about our pain as patients, one thing I can recommend is explain how much it hurts, obviously, explain the type of pain, explain how it affects your daily living. But one that will always get a little bit more attention is explain how has it affected your work. So if it has decreased your ability to work, they will take attention. It will be like, oh, we should probably get them back to work. So that is one way to take a subjective finding and make it very, very important. So when we're treating, we want to work on surrounding tissues. We want to make sure every single muscle around that injury site is relaxed. We want to make sure that we can maybe strengthen the muscles that could be helping to keep that injury site nice and safe. So if we're looking at a lumbar spine injury, maybe we treat some of the muscles around. We're going to treat glutes over the sheets for safety, but then we're also going to look at strengthening the core muscles, because if we can take some of the curve out, we're going to open up a little bit of room and we're going to see some of the nerve roots relax a little bit sometimes. We can also treat, though, the other areas that have been affected. So if we have an injury to the back, you're probably not sleeping well. If it's cervical spine, you may have headaches that are secondary to that. Let's treat all those areas. So make sure you're telling your therapist about the other concerns as well. You want to make your patient aware of the pain level. If other things have helped in the past, so if you are seeing physio, we love that. We love that we're having a collaborative care. We want you to be seeing all types of practitioners. Did they do something that worked for you? Tell your therapist. Maybe they can incorporate that into the treatment as well. What medications you're on. If it's a nerve medication, so gabapentin, something like that, I don't usually see a lot of problems because it is going to be helping the nerve pain, but you still have sensation. Where if we're looking at opioids or NSAIDs, which not as commonly used for nerve pain, those ones are actually going to be deadening senses. So we try and be a little bit more careful with pressure, etc. But when it comes to gabapentin and that family, I don't usually tell my therapist to hold back too much. Any imaging or reports, if they haven't given them to you, don't stress. Just try and let us know what you've heard from it, per se. We can usually decipher if it's kind of like that telephone game. Your doctor said this, you took it as this way. It doesn't have to be perfect. I can usually figure out what you're trying to tell me. And then usually I'll write it down in your phone for you so that you have it for next time.
Right. If I can make a suggestion as well, when you go to your doctor and they're reviewing the report with you, ask your doctor if you can record the session. Most will let you. Not that somebody like Jessica is going to want to listen to that whole thing, but at least you can go back to it and take good notes and pick out those high points for the therapist.
If it is your initial appointment for your imaging results, if you request that they print them out, they should do it on the spot and they should not be charging you for it. It's more so if you call and then you're taking so much of their time that they'll charge you for it, they shouldn't be charging you for it. If it's a piece of paper, the average price for a photocopy is around 5 to 10 cents. So that is what they should be charging you.
Yeah.
That's the going rate we do a lot of MVAs as well. So that's what I charge if I have to print something out. Most times I don't because I feel bad because the person clearly hasn't been working. So I don't charge them, but I'm different. I'm compassionate.
Yeah.
But yeah, if you're there and they're going over it, ask. You never know. I don't know. I actually did, though, the last MRI I paid for because it was putting me out of work and I had budgeted for that because that I learned from, that was what I started doing when I was a young age. I don't buy fancy shoes. I buy MRIs, but they actually gave me the little stick. So I got to watch all of them. So what we're going to be treating when we're doing this, we're going to be assessing, we're going to be listening. I, as a therapist, really want to know how this is affecting you on the day-to-day. That is a great way for us to determine whether or not treatment is working. Not just, can you bend over more? Can you twist? That doesn't matter to me as much as, are you actually happy? Are you able to get up and have lunch? Are you able to maybe go to work, or can you enjoy time with your kids or grandkids? That is far more important than, can you twist your back? Like, let's be realistic. So patient-centered goals, I always like to throw one of those in there. Like, do you want to be able to get a whole 8 nights sleep? Or do you want to be able to pick up your 45-pound toddler grandchild? That's a realistic goal. And it makes it more fun when you're going into treatment and you're actually working towards something that you enjoy. Okay.
Good.
Again, we're going to talk always about if we have secondary symptoms, so the headaches, opposite arm pain, let your therapist know. They should be asking you. We're going to be assessing you at the end of your treatment. This one's usually a little bit faster, but it can make you feel so good when not only is the pain a little bit better, but all of a sudden you have a bit more movement. That helps the patient. And then you should always be asking for, if you'd like, or receiving referrals, tips, tricks, and home care. Lots of times, even if it is a clinic or a practice that doesn't have, say, other practitioners on staff, usually there's a pretty good referral group. So with our practice, I'm crazy specific about who we refer to because I have firsthand experience. If it is just a go find a physio, maybe take a moment and ask if they have one that they'd recommend, if they know of one that works specifically with neuropathy. Because the same thing, you don't want to be calling around or going to 15 different physio appointments just to find one that you like and or that you feel confident in. That is important. So for yourself, you want to speak up. If you are uncomfortable, please always let the therapist know. So that goes both ways. If you're uncomfortable in the treatment plan that was proposed, say we want you face down to work on your back, but you know it hurts a lot to lay flat on your stomach, let us know. We can put a bolster under your stomach to kind of take that curvature out, but we don't know unless you let us know. There should be no suffering through this. We're here to help. You know your body best, so always pipe up, let them know what worked. Jot down how long your relief lasted. I try not to ever ask you to write these crazy reports about your pain, like who's had a nerve block done, who's actually filled out the sheet that they give you after the nerve block. On hour 1, I had this much pain and it was this much. And on hour 2, I had this much pain. No. Hey, how long did you feel better for? 2 days, 3 days? What came back first, the burning or the sharp shooting pain? That we can work with. It becomes quite a problem when you have to fill out pages and pages and pages every single day. That honestly, if it's your dominant hand and you're filling out those pages, you're probably irritating that nerve root. So let's just make it simple. Let's see how happy you were and what we can do moving forward, because then we can adjust our treatment plans. We're big on realistic goals. Neuropathy due to chemotherapy. So bit different than the injury. One thing that I'd love to push home is that massage therapy is effective and safe for individuals undergoing chemotherapy, whether it's for an oncology treatment or MS or for some other reason. You do, however, want to look for a therapist who has advanced certification in oncology, usually because with the oncology aspect, that's where you're seeing the chemo training. Sometimes you will be asked to provide a doctor's note. That's usually just to make sure they've given you the okay. It's not fun getting an email or a phone call from a doctor. Usually it's not that it's not safe. Sometimes they just like to have it checked, and then it gives us peace of mind. Let your therapist know what happened when the symptoms started. So was it just with the neuropathy, or was it just with the chemotherapy, or was there also a surgery that went hand in hand that could actually be involved in the neuropathy as well? Because that way we're going to adjust our treatment. So with chemo, we're seeing more of the fingers and the toes, the foot pain, the tingling. But if we're also looking at, say, mastectomy, there can be nerve damage to the axilla area, which is a huge bundle of nerves. So we want to make sure we're treating every single area that's involved. Same thing, if you get your reports send them on over. If your oncologist or your primary care provider has anything specific that they want treated, that's absolutely great. We'd love that feedback as well. So when we're treating this, we're going to be treating completely as a whole as a human. So the question earlier, if the pain, neuropathy, and the symptoms are usually in the feet, are we going to treat elsewhere? With chemo, we usually like to, because we want to get the circulation up, we want to get the lymph moving, but we also want to make sure that you are comfortable, because we're probably going to be looking at a lack of sleep as well. Chemo usually has some pretty horrible side effects. So if we can help treat the side effects from the nausea and the vomiting as well, or the headaches, that's great. We can do all of those things in one treatment. When we are talking about actually treating, we're going to be discussing the sleep, the movement, and the fatigue. What have you been able to do? Because we can sometimes look ahead and predict where we might be seeing pain next. So if you have been bedridden, we're probably going to see low back pain. We're going to be seeing knee pain as well, on top of the neuropathy. We will always accommodate for nausea, tenderness, bruising, lines, etc. It's not hard to do. That being said, it can be a bit challenging if we're undergoing chemotherapy to get to a clinic. That's usually where I would suggest finding a mobile massage therapist so you feel comfortable. You're not overexerting yourself, because we want you not to feel fatigued if you don't have to, or as fatigued. We're going to treat all the areas of concern. We do like to schedule around chemo dates. So just not the day of, or perhaps we can have a massage right before, but not immediately after. If it's round 2 or 3 and we know when that peak nausea and vomiting is going to hit, let's avoid that day. Not that we can treat. It's not a problem, but it's up to you and how comfortable you are. Same thing, we're going to be doing the patient education, the referrals, the tips and tricks. The only medication that we worry about with chemo is the lovely nickname of the red devil. That one can actually come through the skin and be transferred onto your therapist. That being said, they wear gloves. Not a big problem at all. You can still have treatment. So, same as before, speak up. Let us know if you're not comfortable. Never feel bad about needing to cut a treatment short or having chemo, or you're having chemo symptoms such as nausea or vomiting. That goes for all of the neuropathy patients. It doesn't matter if you're not feeling well, things are getting worse, other symptoms are happening. Let your therapist know. End the session. It's going to make all of the symptoms worse if you lay there. And let us know if you have any medication changes as per usual. Are we good on the oncology and chemotherapy?
I think so.
Diabetic neuropathy. So completely safe as well. The one thing we will avoid though are areas that ulcers. We don't want to be touching open wounds. It's an area that we could cause an infection then. We will avoid that area, but not too far from it. So we still want to be promoting circulation. We still want to be treating the area, but we will never be rubbing over an open wound. That's just not going to happen. We also will avoid treatments that can compromise the skin. So anything that we could be the catalyst for creating an open wound, we're going to avoid. So things like dry brushing, salt scrubs, etc., usually something we would avoid. There are ways for us to get the circulation going, getting lymph moving. With our hands, we don't have to use outside tools. Cupping is not a good idea if we're looking at diabetic neuropathy on any of the limbs that are actually affected. If it's the back and you want some cupping done, okay. But if it's a foot, probably not a good idea. That skin can be very sensitive. One thing we do request if it is diabetic neuropathy is that you let us know not only where or what medications you're on, but where are your medications in case you do have a diabetic episode, in case you do have a hypoglycemic episode go down. We want to be able to help you. So it's a safety precaution. Have you had anything to eat today? Because if you're on the table, the blood pressure can drop, your blood sugar can drop. We want to make sure that you're as safe as possible. Other than that, there's not a lot of things that we want to take into consideration additionally with diabetic neuropathy, other than the best thing you can do is start getting treatment early. So same as when they're saying to be active and they're saying to keep moving, massage therapy can be kind of the answer to that. You don't have to go walk 15 kilometers. If we're going to be moving those joints and those limbs, and we're going to be promoting that circulation as well, and we're going to be bringing blood to the area and pushing it back up, that can take a little bit of the burden off of you for keeping moving.
Jessica, we had a question from Bill. What is dry brushing? I didn't think I could explain it well in the chat, so I thought.
Well, Bill, so imagine a toothbrush and you're going to multiply it by 100. So it's about this big, like the head of a toothbrush. And what it is you're going to take it, and it is usually like a nice, like kind of like a coarse hairbrush, and you will be brushing the skin. And what it does do is, while we're brushing, it's going to be moving lymphatic fluid up and away from areas. It is something that some massage therapists can do. It is also seen frequently in a spa treatment to promote exfoliation of the skin. Would just stay away from it if we are dealing with any sort of diabetic neuropathy. Is that a good explanation for somebody that's never seen a dry brush?
I think so. I have one. It's not nearly as big as you were saying. It was maybe about half that size, but
Little one?
yeah. But basically the purpose is to gently brush, and you have to do it in the right direction.
And down.
Brush your skin towards the heart so that you're draining that lymphatic fluid.
It is nice, depending on the person. See, and I won't do it anywhere that I have any nerve pain, because it irritates it automatically. Yeah. Where on my legs, I'll still do it, but no, I won't. But anything that can compromise the skin, we're very, very cautious of with diabetic neuropathy. Same with the hydrotherapy. You can have hydrotherapy, absolutely, like a hot pack. The therapist should be checking on that hot pack frequently, because you may not have the same amount of feeling. Anyone that has any sort of lack of feeling, make sure that the therapist is checking on it.
So are there other, I mean, I think you can get ulcers if your neuropathy is bad enough, no matter what, but I'm thinking specifically about lupus. Does lupus have the same kinds of problems with ulcers as
they can?
Yeah.
So anytime we're looking at open skin, the massage therapist should be staying away from it.
Yeah, for sure.
But at the same time, not ignoring that limb completely. So it's a fine line.
Yeah.
Because if the therapist doesn't have experience in it, that might be their go-to. Like, I'm not touching that side at all, when really you do need treatment on that side.
Yeah.
So just, that's why it always comes down to, like, does the person have experience in it?
Is there a balance kind of thing? So if a person has a really stiff left side, would the massage therapist make sure that they also do corresponding work on the right side so that you're not
balanced out?
Yeah.
Back in the day, and I believe it's probably still taught at the school level, is that you treat the unaffected side first. So say there's neuropathy on the left side, you're taught to do a quick treatment of the right side first. It's not completely necessary, because sometimes, like that, you run out of time, then you're not giving the other side as much treatment as necessary. However, it makes for a great comparison when you're palpating or testing the muscles and testing the tissue to see if this is, quote, normal side. There is no normal, but normal, and then not good side. How does this one feel comparative to this? That'll give you an idea of how bad things are. If we are dealing with severe tightness on the one side, severe pain, and we spend a lot of time on the left, it is always a good idea to do a quick treatment on the right, though, just so that that side doesn't feel neglected. Or if you're laying or you're sitting for that long, it doesn't become stiff. Because chances are this side is still being the side that you're compensating with, right? So it deserves some TLC as well.
Cool.
So we try to. It's not completely necessary, but it's always a better idea too.
Right. Okay.
So as usual, speak up. Let your therapist know, though, if you're feeling off, so that we can deal or assist with the diabetic emergency if needed to. If there have been amputations, so post-surgery, scar work and mobility are absolutely key. So those are things we can help. So scar tissue, it can be quite painful. Scars are not as superficial as they once thought they were. So we want to make sure that we're treating that scar at the earliest possible time. So the wound needs to be brought together. It needs to be healed per se, stitches, staples, that needs to be come out. But when it's still a little bit pink, that gives us the best time for us to actually make some changes to that tissue as much as we can so that you have as much mobility. Regular treatments are always a game changer with this one as well, because we want to make sure we're testing out, seeing how the range of motion is going, how the pain is going, and helping you promote that circulation. Idiopathic, the most frustrating of all frustrating, when they can't give you an answer for why something is not fun, why it hurts or why it's happening. It can be incredibly, incredibly horrible for the mental health as well. It's still treatable though. So we may not be able to treat the underlying cause of the neuralgia, but we can absolutely go ahead and we can treat the symptoms that you're feeling. So is there tingling, numbness, pain? Are you super sensitive to cold? Are other areas of your body sore? How's the sleep going? Treat it the same as any other neuropathy. We just might not know what's happening. With this, the first thing we're going to look at though is do no harm. So we might take a slower approach because we don't have a diagnosis. We absolutely don't want to make anything worse while they're looking for diagnosis, or you never know, maybe there could be one eventually. Doesn't mean that you're not going to have an effective treatment. Maybe 2 or 3 sessions in, then we'll start to actually use a little bit deeper pressure if that's what needed. We just don't want to go in and make something worse. What works for you? That's always going to be a question. Do you like heat? Do you not like heat? Do you like firm pressure? Is light pressure going to be irritating you? Let your therapist know. Genetic, please know that we specifically, but lots of therapists see very complex conditions and very rare things. It doesn't mean you don't deserve treatment. It is annoying having to explain to people what condition you have all the time. I know, or trying to explain how severe it is. But if you do it, you're going to get a great treatment. So try and let them know ahead of time, send an email, even if you've filled out in the intake form what it is. Ideally, your therapist should be checking those intake forms as the bookings come in that evening. But if by chance they didn't have the opportunity to, maybe sending a follow-up email saying, hello, I booked in, I filled out my intake form. I just want to alert you that I have this condition. Could you please let my therapist know in case they need to look into it more? This way, they will have time to research something if they need to.
It's a great idea.
Mm-hmm. And then they will know about that condition. So stress what your goals are. I cannot stress that enough. It's your life. It's your pain. You're having the loss of the ability to do things that you once could. You need to let them know what your goals are. Alcohol, toxic neuropathy, being open with your therapist. There should be no judgment. These are healthcare providers. Don't worry. Increasing mobility. We want to get you as mobile as possible. Treating areas of numbness gently, but effectively, still cautious if there's any sort of loss of sensation. Comfortable mispositioning to promote circulation. When I talk about that, we talked about going, if we're face down on the treatment table, having maybe a cushion underneath the tummy for a little bit more of a curve in the spine. If we're on our backs and say your neck is being treated, you can have 2 or 3 pillows propped up behind you, so you're more of in a half lay down, so that in case you do feel dizzy. These adjustments can be made. Same thing if we're looking at amputation, post-surgery, scar work, mobility. Treat all areas of concern, and realistically, what is your home care regime going to look like? So if they give you a piece of paper that has 10 exercises on it, say, unfortunately, I cannot do all these. I am in a lot of pain. Can we maybe move these down to 3 for now? If they tell you no, then you may want to find a new provider, because that's just not beneficial to the person. With any neuropathy, always, 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 please use your descriptive words if possible. Nerve pain. There's a lot of different describing words for that. Each one is felt differently, right? So if it's sharp shooting or it's tingly, it's going to determine how we treat. The type of treatment that we provide, the type of approach we take. So whether it's like a flat hand with medium pressure, or we use our forearm or our elbow, that can be determined as to what type of nerve pain you're experiencing. Let the therapist know if you feel cold or hot. We can take off blankets, keep on light sheets. We can add blankets. We can add table warmers. We want you to be comfortable. If you are relaxed as much as possible, your treatment will go better. Any areas of pressure feeling. If you feel as though your calf area feels like it's going to burst, please let us know. We can work on lymph. We can assess the area and see if you are having increased swelling. We have an outside kind of look at everything. We can compare one limb to the other, where half the time I'm like, I can't see the back of my shoulders or the backs of my legs. We can let you know if there's something else that you might want to know about. And be honest and stress how your condition negatively impacts your life. You're not whining. It's not fun. It sucks. So let them know. Being tough, it maybe feel like it's a badge of honor, but you get a better treatment if you weren't. But at the same time, like, I do understand, crying or being frustrated and being vulnerable, it's very tiring and it is exhausting and can make pain worse. So using describers like, I can't stay awake until or after 2 p.m. or I can no longer do this, this, and this. You don't have to get super emotional, but by giving those kind of checklists for what you cannot do anymore, that will help.
Right. Before you move on, I just wanted to say for people, we did do we have sort of support meetings, and one thing we spent some time on earlier this year was coming up with descriptive words. And so we put it into a little table of descriptive words, sort of from intensity and anyway. So if anybody's interested in that, they can contact me. And we have a question from Stan.
Hi, Stan.
Hi, Stan. Is massage beneficial after knee replacement, and how soon, if so?
Once your sutures have healed, they've taken out any staples, you can begin massage therapy as soon as they tell you to start beginning physiotherapy. So we can work on scar tissue. We act as kind of secondary physios as well. So they can give you the exercises. Just let your massage therapist know that you have been given exercises by the physio, and we can work on the hips, the low back. We can work on that leg. We can help with the range of motion as well. Very helpful.
So when you're talking about scar tissue, if you catch it early enough, does that mean you'll, with massage therapy, you'll be able to end up with less scar tissue? Yeah.
So if we keep the movement of the tissue surrounding it increased as well, you can stop everything from kind of not duplicating, but scar tissue is not just, it's like you see the scar on top of the skin. There's deep scar tissue, but everything tightens up because that scar is pulling, right? That's why you see the dimples. So if we can work on keeping this area around the scar lengthened, and then we do work to the scar itself, increasing that mobility, it will decrease the amount of pain that you have afterwards.
Right. So I can see that being really important, because if you already have some muscle atrophy because of your neuropathy, like I have, you know, getting a knee replacement and then adding scar tissue on top of those already atrophying muscles, you're just compounding your whole problem. So
yeah. And it hurts.
Good idea, Stan. You got to do
Good
that.
job, Stan.